and I am doing video 2 with the lungs, cardiac, and abdomen. We'll start off with the lungs with Edmund. How are you today? Good. Okay. Just open your mouth. Tongue is pink, mucosa is pink and moist, so that shows a good sign of oxygenation. I'm going to start off with just the overall chest shape. I'm going to have you take off your sweater. Okay. Okay. And just sit up straight. Chest is symmetrical. There is is consistent with, and the skin is warm and brown and consistent color across the back and the chest, the thoracic area, and there. Respirations are evenly noted at 16. Take a deep breath for me. Okay. You can let it out. It is the chest wall is symmetrical, and there are no bulges, masses, or lesions. The sternum is midline. And the clavicles are both the same height. Vertebrae is midline, and the thoracic cavity is the same thoracic, lumbar, and curves are all following normal curvature. And costal angle is less than 90. All right. I'm going to check for tactile fremitus, and what I need you to do is I just want you to say 99.
99.
Go ahead and keep repeating.
99, 99, 99, 99, 99.
Okay. All right. And that is appropriate for tapering from the scapula to the base of lungs. All right. And I'm going to do percussion on your lung fields bilaterally. Okay, so. Okay. If we were to percuss the diaphragmatic excursion, she would be leaning forward and crossing her arms and holding her breath. That is generally 3 to 5 centimeters, found at generally at the T10. And if it was shortened, it would be a sign of emphysema, atelectasis, and respiratory depression. All right, I'm going to listen to your lung sounds. Raise your hands above your head. Okay, and breath sounds are clear bilaterally. All right, going to be inspecting the chest for heaves, lifts, or thrusts. Okay, just put your hands down here and lean forward a little bit and then straighten up. Just sit straight back up. Okay, and there is no anomalies found there. The PMI is found at the 5th intercostal space, and that's palpated. And there are no murmurs noted. Okay, and I'm going to check for your heart sounds. Okay, and this would be the aortic, which is found, aortic valve, which is found at the 2nd intercostal space. Pulmonic valve is found at the 2nd intercostal space. Erb's point, 3rd intercostal space. The tricuspid valve at the 4th intercostal space. And the mitral valve, which is found at the 5th intercostal space, which is also the PMI. And that is also the apical valve also. And the aortic and the pulmonic valve are usually heard best with S2, and the tricuspid and mitral valves are generally heard best at S1. Did not hear any S3s or S4s. I'm going to also palpate the pulses. The temporal pulse is noted here. Brachial pulses are noted here. Radial pulses here. Going right back. Femoral pulses would be noted here. That's the popliteal pulses here. Posterior tibial pulses here. And dorsopedial pulses on top of the foot. Thank you. The pulses are strong, not bounding, equal, and no threading. All right, let's see if we can lift up our page here. I'm going to be checking your abdomen, so if you go ahead and lay your back for me, please, and just thank you. Okay. All right. On the abdomen, the skin is even toned. There's no striates, no vascular patterns. Sorry, my hands are cold. And there are no bulges. Look with a flashlight here. Not seeing any bulges here. All right. The umbilicus is inverted and appropriate. The abdomen is contour, and it's symmetrical. There's positive pulsations with the abdominal aorta, and there's no hernias, no bulges, and I'll listen just for a few minutes. Okay. Normally you listen to the abdominal sounds for 60 seconds each. Over the 4 quadrants, starting with the right lower quadrant. The arteries are the aortic, abdominal aortic, the ileus. Oh, I'm sorry, the renal, I'm sorry, renal, the ileus, and then the femoral, just deferred. Okay, and there's no rubs or brutes heard. And abdominal sounds are appropriate. The abdominal sounds were tympanic, except for over the liver and spleen. And percussing the abdomen, oh, okay, I'll be out in 5 minutes. Okay, thank you. Oh, gotta leave. Gotta use the road. Okay. Okay, and with the liver, with palpating the liver, the liver is 8 centimeters. Okay. And palpating midline, it is 7 centimeters, which is appropriate. Palpation of the liver, there was no enlargement noted. Spleen is not palpated. The spleen is under the costal margin and is not able to be palpated. Kidneys would be palpated here, and there's no enlargement there. All right, and that is the end of our assessment at this time. Thank you.